Have you ever looked down at your legs and wondered why they suddenly feel heavier than they used to? Maybe your feet are colder than the rest of your body, even on a warm day. Perhaps your ankles seem swollen by the evening, or you wake up in the middle of the night with painful leg cramps that interrupt your sleep. For many adults over the age of 60, these changes appear so gradually that they are often dismissed as nothing more than a normal part of getting older. Friends may say, "That's just what happens with age," and even family members may assume it's unavoidable. But what if your legs have actually been trying to tell you something important all along? According to many vascular specialists and surgeons who treat circulation problems every day, poor leg circulation is incredibly common among older adults, but it should never be ignored. Healthy circulation is essential because your blood carries oxygen and nutrients to every muscle, nerve, and tissue in your body. When blood doesn't move as efficiently as it should, your legs may become tired more quickly, your muscles may feel weaker, and everyday activities like walking to the mailbox or climbing a few stairs can suddenly seem much harder than they once were. The good news is that in many cases, there are simple lifestyle habits that may help support healthy blood flow. In fact, one easy exercise recommended by many healthcare professionals as part of an active lifestyle can help activate the muscles in your lower legs that naturally assist blood in returning to your heart. It doesn't require expensive equipment, a gym membership, or hours of your time. You can perform it in the comfort of your own home, and for many people, it takes only a few minutes each day. Now, before we reveal exactly what this exercise is, it's important to understand why circulation becomes more challenging as we get older. As the years pass, our blood vessels naturally become less flexible. We also tend to spend more time sitting than we did when we were younger. Retirement, long hours watching television, reading, or using electronic devices may lead to less movement throughout the day. Even small reductions in daily activity can affect how efficiently blood flows through the legs. Muscle strength also changes with age. The calf muscles, located at the back of your lower legs, play an important role in helping move blood upward toward the heart. Some healthcare professionals even refer to them as the body's second heart, because every time they contract during walking or simple movements, they help squeeze the veins and encourage blood to continue circulating. When these muscles become weaker or are used less often, blood may not move as effectively, which can contribute to feelings of heaviness or swelling. Poor circulation doesn't always announce itself with dramatic symptoms. Sometimes the warning signs are surprisingly subtle. You may notice that your legs tire more quickly during activities you once enjoyed. Your feet may frequently feel cold, even when the rest of your body feels comfortable. You might experience tingling sensations, mild numbness, or occasional muscle cramps during the night. Some people notice that small cuts or bruises on their legs seem to take longer to heal than they used to. Others simply feel that their legs lack energy or become stiff after sitting for a while. Of course, these symptoms can have many different causes, and not every case is related to circulation. That's why it's always important to discuss persistent or worsening symptoms with your healthcare provider. A proper medical evaluation is the best way to determine what's causing your discomfort and what treatment, if any, is appropriate for your individual situation. One of the biggest misconceptions is that improving circulation always requires medication or complicated treatments. While some people certainly need medical care, specialists often encourage patients to begin with healthy daily habits whenever appropriate. Regular movement, staying physically active, maintaining a healthy weight, eating nutritious foods, drinking enough water, and avoiding long periods of sitting all play important roles in supporting vascular health. Even gentle exercises performed consistently can make a meaningful difference over time. That's exactly why today's exercise has attracted so much attention. It's simple enough for many older adults to perform safely, yet it targets one of the most important muscle groups involved in healthy circulation. The movement is gentle, low impact, and can easily fit into your daily routine. Whether you're watching television, preparing a meal, or taking a short break during the day, this exercise may help keep your leg muscles active and encourage healthy blood flow. In just a moment, I'll show you exactly how to perform this movement correctly, explain why it works, and share a few simple tips that can help you get the most benefit. Now it's time to learn the simple exercise that many vascular specialists and physical therapists recommend because it helps activate one of the most important muscle groups for healthy circulation. It's called the heel-to-toe calf raise, and although it may look almost too simple to be effective, don't underestimate its power. When performed correctly and consistently, this gentle movement encourages your calf muscles to contract and relax, helping support the natural return of blood from your lower legs back toward your heart. Before you begin, choose a safe location. Stand behind a sturdy chair, kitchen counter, or another stable surface that you can hold for balance if needed. Wear comfortable shoes with good support, or perform the exercise barefoot on a non-slip floor if that feels safer for you. Make sure the area around you is clear of rugs, cords, or anything that could cause you to trip. Start by standing with your feet about shoulder width apart. Keep your posture upright, relax your shoulders, and look straight ahead rather than down at your feet. Hold the chair lightly for balance if necessary, but try not to lean your full weight onto it. The goal is to let your leg muscles do the work. Now slowly lift both heels off the ground until you are standing on the balls of your feet. Rise only as high as feels comfortable. There is no need to rush or force the movement. At the top, pause for 1 or 2 seconds. During this pause, your calf muscles tighten, creating a gentle squeezing action that helps encourage blood to move upward through the veins. Next, lower your heels slowly back to the floor. Avoid dropping them quickly. A slow, controlled motion allows the muscles to work through the entire movement, making the exercise more effective. Once your heels are back on the ground, gently lift your toes while keeping your heels planted. This activates the muscles at the front of your lower legs and improves ankle mobility, which also plays an important role in comfortable walking and overall leg function. Repeat this sequence slowly 10 to 15 times. If you're just starting, 1 set may be enough. As your strength and confidence improve, you can gradually work toward 2 or 3 sets each day. Many healthcare professionals suggest performing this exercise once in the morning and again in the evening to help break up long periods of sitting. One of the reasons this exercise is so valuable is because of how the veins in your legs work. Unlike arteries, which receive blood pumped directly from the heart, veins rely heavily on surrounding muscles to help push blood upward against gravity. Inside these veins are tiny one-way valves that help keep blood moving in the correct direction. Every time your calf muscles contract, they gently squeeze the veins, encouraging blood to continue its journey back to the heart. This is why the calf muscles are often called the body's second heart. If you spend several hours sitting in a chair, driving, watching television, or working at a computer, those calf muscles remain relatively inactive. Without regular movement, blood may pool more easily in the lower legs, contributing to feelings of heaviness, swelling, or stiffness. That's why even short periods of movement throughout the day can make such a difference. If standing feels uncomfortable or you have balance concerns, don't worry. A seated version of this exercise can still be beneficial. Sit in a sturdy chair with both feet flat on the floor. Lift your heels as high as you comfortably can while keeping your toes on the ground. Hold briefly, then lower your heels. Next, keep your heels on the floor and lift your toes toward the ceiling. Repeat the movement slowly 10 to 15 times. Although the seated version may not challenge your muscles quite as much as the standing version, it still encourages regular muscle contractions and helps reduce stiffness from prolonged sitting. As you perform the exercise, remember to breathe normally. Never hold your breath, as steady breathing helps your body remain relaxed throughout the movement. Focus on smooth, controlled motions rather than speed. Faster isn't better. In fact, slow repetitions often activate the muscles more effectively. It's also important to listen to your body. You may notice mild muscle fatigue, especially if your legs have been inactive for some time. That's perfectly normal. However, you should stop immediately if you experience sharp pain, severe dizziness, chest discomfort, sudden shortness of breath, or significant swelling that becomes worse during the exercise. These symptoms require prompt medical evaluation. While this exercise can help support healthy circulation, remember that it is not a cure for serious vascular disease. Conditions such as peripheral artery disease, deep vein thrombosis, severe varicose veins, or advanced diabetes require proper medical diagnosis and treatment. Think of this movement as one helpful. By now, you've learned how one simple exercise can help activate your calf muscles and support healthy blood flow. But here's something every experienced surgeon and vascular specialist will tell you: no single exercise can do everything on its own. The greatest improvements in circulation usually come from combining several healthy daily habits. The good news is that these habits are simple, practical, and can fit into almost any lifestyle. The first habit is to avoid sitting for long periods without moving. Many adults over 60 spend several hours each day watching television, reading, using a computer, or relaxing in a favorite chair. While there's nothing wrong with enjoying these activities, remaining still for too long allows the muscles in your legs to become inactive. Since those muscles help push blood back toward your heart, long periods of sitting may contribute to stiffness, swelling, and that heavy feeling in your legs. A simple solution is to stand up every 30 to 60 minutes. Walk around your home for a few minutes, perform a few heel-to-toe calf raises, or gently stretch your legs. These small movement breaks can help keep your circulation active throughout the day. Even a short walk to the kitchen, the mailbox, or around your living room is better than remaining seated for hours at a time. Walking is another excellent way to support healthy circulation. You don't need to walk long distances or move at a fast pace. Even a comfortable 15 to 30-minute walk most days of the week can help strengthen your leg muscles, improve endurance, and encourage healthy blood flow. If walking outdoors isn't practical, you can walk inside your home, around a shopping center, or wherever you feel safe and comfortable. Staying hydrated is equally important. Blood contains a significant amount of water, and drinking enough fluids helps your body function properly. While hydration alone won't cure circulation problems, becoming dehydrated may make it harder for your body to maintain normal circulation. Water is usually the best choice, although your healthcare provider may recommend specific fluid guidelines if you have certain medical conditions such as heart failure or kidney disease. Nutrition also plays a major role in vascular health. A balanced diet rich in colorful vegetables, fresh fruits, whole grains, beans, nuts, fish, and lean sources of protein provides nutrients that support healthy blood vessels. Many experts also recommend limiting highly processed foods, excess salt, sugary drinks, and foods high in saturated fat. Small improvements in your eating habits, maintained over months and years, can contribute to better overall cardiovascular health. If you smoke, quitting may be one of the most powerful steps you can take to protect your circulation. Smoking damages blood vessels, reduces oxygen delivery, and significantly increases the risk of peripheral artery disease and other cardiovascular conditions. Quitting isn't always easy, but healthcare professionals can provide medications, counseling, and support programs that greatly improve the chances of success. Maintaining a healthy weight can also reduce extra stress on your heart, blood vessels, and joints. Even modest weight loss, when recommended by your healthcare provider, may improve mobility and make physical activity feel easier. Remember, the goal isn't perfection. It's steady progress to realistic lifestyle changes that you can maintain for years. Some people may benefit from compression socks, especially if they experience leg swelling or certain vein conditions. However, these should not be used without appropriate medical advice, particularly if you have peripheral artery disease or other circulation disorders. Your healthcare provider can determine whether compression garments are appropriate for your specific situation. It's also important to manage chronic health conditions that affect circulation. High blood pressure, diabetes, high cholesterol, and heart disease all influence the health of your blood vessels. Taking prescribed medications, attending regular medical appointments, and following your treatment plan are essential parts of protecting your circulation as you age. Now let's talk about warning signs that should never be ignored. While occasional tired legs after activity may be normal, certain symptoms require prompt medical attention. Contact your healthcare provider immediately if you develop severe pain in one leg, sudden swelling in only one leg, skin that becomes unusually pale, blue, or cold, sores on your feet or legs that don't heal, or pain in your calves that consistently occurs while walking and improves only with rest. These symptoms may indicate a more serious circulation problem that requires professional evaluation. Remember that improving circulation is usually a gradual process. You may not notice dramatic changes after 1 or 2 days of exercise. Instead, think of each healthy echoic